Nearly 50 years apart, Alabama's prison system faced federal intervention for essentially the same constitutional failures. This is not simply a comparison of two dates, it is a study in institutional memory. When the federal government steps in once, it signals crisis. When it steps in twice for similar reasons, it signals systemic failure. In 1976, federal courts ruled that Alabama prisons violated the Eighth Amendment. In 2019, the Department of Justice reached the same conclusion, this time describing deliberate indifference to violence and abuse. The terminology evolved. The constitutional basis did not. The question becomes, how does a system return to the same constitutional breach after decades of warning? The 1976 case, Pugh v. Locke, exposed what federal courts described as conditions untethered from legitimate correctional goals. Violence was unchecked. Facilities were unsanitary. Control had effectively shifted from staff to inmates. The result was not advisory reform. It was receivership, over a decade of federal control to force constitutional compliance. Fast forward to 2019. The DOJ investigation found that Alabama prisons had the highest homicide rate in the nation, multiple times the national average. Weapons were readily available. Extortion networks were entrenched. Staffing levels were dangerously low. The difference between 1976 and 2019 was not the presence of violence. It was the scale and documentation of systemic collapse. The patterns between eras are nearly identical. Overcrowding in the 1970s was ruled unconstitutional. By 2019, facilities were operating far beyond capacity. Violence was labeled a jungle atmosphere in 1976. In 2019, Alabama was described as the deadliest prison system in America. Understaffing was a crisis then. By 2019, some facilities operated at less than one-third required staffing levels. Different decade, same structural weaknesses. One key difference in 2019 is the role of parole policy. Grant rates declined sharply over recent years, creating a bottleneck effect. Low-risk and elderly inmates remain incarcerated longer. Population pressure increases. Overcrowding intensifies. The system expands not because crime is rising, but because release mechanisms constrict. Alabama's prison population has aged significantly. Men over 50 have increased dramatically, while younger inmate populations have declined. This shifts the cost structure. Healthcare expenditures rise. Medical complexity increases. Modern prisons are housing geriatric populations in facilities designed decades earlier. The state's response to DOJ findings focuses primarily on infrastructure, building large, modern facilities. The logic is straightforward. Newer buildings equal safer conditions. However, construction addresses environment, not culture, staffing, or operational oversight. Infrastructure reform without structural reform may simply relocate dysfunction. Alabama already tried large-scale prison construction during the 1980s. 5 new prisons were built. Incarceration increased dramatically afterward. The lesson is clear. Expanding capacity without addressing policy drivers leads to expansion of incarceration, not resolution of systemic conditions. An alternative approach reframes prisons as rehabilitation centers rather than warehouses. This model emphasizes education, trauma treatment, literacy, and skill building. It prioritizes human capital investment over structural expansion. The contrast is philosophical. Hardware versus software. Containment versus correction. Modern reform can leverage technology to address one of the central failures cited in both 1976 and 2019, lack of supervision. AI-assisted monitoring systems, digital work release tracking, and public transparency dashboards can reduce blind spots. In both federal interventions, the problem was not just violence, it was failure to detect and prevent it. Neither federal intervention emphasized programming as the central solution. Yet research consistently shows education and structured rehabilitation reduce recidivism and violence inside facilities. Reentry readiness reduces long-term population pressure. Ignoring programming perpetuates the cycle. Another solution is to reform sentencing laws to reduce the prison population. This includes abolishing mandatory minimum sentences and expanding alternatives to incarceration. Isolation exacerbates instability. Maintaining family connections is strongly correlated with reduced misconduct and lower recidivism. Reform models that preserve communication networks directly target behavioral outcomes, something neither 1976 nor 2019 interventions structurally solved. The comparison reveals two competing strategies: build more infrastructure or redesign the system. History suggests that buildings alone do not cure constitutional violations. Compliance requires operational reform, accountability, and sustainable population management. Federal oversight is not the root problem. It is a symptom. The underlying issue is institutional culture, governance, and policy alignment. In 1976, Alabama was forced to change. In 2019, it was warned again. The decision now is whether to innovate or repeat the cycle.